Hi, everyone. So today we're going to be talking about stress management for parents. I'm Ronica.
I'm Sierra.
And I'm Quinn.
Okay, so first, before we get into our mindfulness strategies, I want to talk a little bit about the stress in the parent-child relationship. In this case, the protective factor for parents is that there's a lot of psychological flexibility as compared to children. We noticed that there's a correlation between parental depressive symptoms and psychopathology in children, which leads to intergenerational patterns of emotion, meaning that usually parents are the role model for their kids and how they display their emotions. So it's important for both the parent and the child to go through different mindfulness strategies in order to better the mental health of each other. Um, Parental regulation is helpful for regulation of children. So, kind of reiterating what I was saying earlier. And because of that, we will be going through three different mindfulness strategies in order to reduce stress, increase resilience, and self compassion, specifically for parents of children with autism.
So now we're going to go into our interventions. The three that we're going to be highlighting here are support groups, deep breathing, and identifying triggers, which with a specific focus on I statements. As far as support groups, a lot of you might be asking why support groups specifically. So one of the reasons is that a lot of services tend to focus on the child. So they tend to kind of deprioritize the well-being of parents while advocating their child. A lot of parents tend to do that just naturally. And there aren't a lot of resources for direct parental well-being as a result. Additionally, there are a lot of public services that just focus on the child inherently. So even beyond the fact that parents tend to focus on their child to begin with, there aren't a lot of public availabilities for these types of things for parents. Also, parents frequently lack emotional, informational, and practical support. And so this kind of leads to, or tends to lead to a lot of isolation and maladaptive coping, which might be like emotion avoidance, suppression. And there's also a lot of parental depression, anxiety, and stress, which then leads to negative impacts on the child, which of course kind of just creates this cycle. And the group format of like a support group also allows for peer validation and just a lot more normalization of difficult emotions and like a shared emotional experience in a non-judgmental space with other parents. So we're going to talk through some evidence for support groups. So EPATS this is taken from a study which looked at early positive approaches to support. And basically, it is an intervention which is an 8-week program that is sessions that are 2 to 2.5 hours. They can be delivered online or in person, and they're co-facilitated by both a professional and a parent dyad. So that parent dyad part is really important, and both are trained. And this targets families with children up to age 5 with IDD, whether it's diagnosed or suspected diagnosis, and it combines psychoeducation activities and peer discussion in the support group. It's transdiagnostic, which basically means that it's not diagnosis specific, and it can help like a range of children, um, a range of children's parents. And also, some key findings that I want to talk about are that the comfortable emotions increased after support groups and uncomfortable emotions decreased by the program's end. So that is huge just in terms of talking about how uh, parents were able to express their emotions. And about 76% of pre-session emotions were comfortable, which rose to 85% post-session. So that just kind of gives you an idea of the like numbers that we're talking about in terms of the increase there. The biggest gains were seen in sessions 1 and 2, which really is amazing because it shows that early psychoeducation validation kind of have rapid emotional impact. So even if parents aren't able to finish kind of this 8-week program, like those first 2 sessions are really impactful and can be super helpful for quick results. Also, peer validation within the group really amplified the emotional processing. So if you get that like peer validation group piece with like a close-knit group, it's really important. And additionally, in terms of like the methodology, it was pretty unique because they used an emotional journaling tool, which included 20 emotions on a 3-point intensity scale, which were administered before and after each session. So I would say that is a pretty unique contribution of this study and could be kind of a model for the self-monitoring component. So sorry, one last slide here, but some things to keep in mind. Look for groups that offer psychoeducation and peer connection because we see that those things are both very important. Look for groups that are co-facilitated by a professional and a parent who has lived experience, and a non-judgmental space that validates all emotions, not just the hard emotions, and also topics that include your well-being, not just your child's needs. Another thing is, so 16 of 19 EPATS cohorts, as we saw on the last slide, they've actually met virtually. So online groups are seen to be effective and are also, of course, more accessible. And research shows the biggest emotional gains happen early, like we said, so early participation does make a difference. And another thing is just notice how you feel before and after sessions. Do a little easy check-in, kind of noticing like shifts over time can be pretty meaningful on their own.
Okay, now we'll move into I statements. There are a couple of steps to creating an I statement. This is mainly when your child is reacting and you have to find a way to communicate what you're feeling and how it affects your child. Often it's easy to make statements that sometimes maybe don't reach the child or aren't satisfying to you, or it's just a lot in the moment to be able to communicate. So this is a way to kind of break it down and communicate with your child a little bit better. So first, you identify the trigger that you're feeling. So notice the feeling in your body when your child is reacting. What's happening in your chest, what's happening in your head, and what emotion is that ensuing, whether that be anger, sadness. Then looking at what does the emotion mean. Find find the feeling um, attached to how your body is reacting and why it's occurring. So an example can be if your kid is upset because they have to go to school, um, and it's causing you a lot of frustration because you have to get to work. So you're feeling frustrated. You're triggered by your child's reaction. Maybe they're throwing a tantrum. You feel frustrated because you have to get to work. So knowing that the meaning behind the frustration is wanting your child to be able to get to school on time and you going to work. Next part would be reframing. So focus on the why and what it means for your child to have a different behavior. So we kind of already touched on that. Making sure your child's on time, that they don't miss anything at school. And so you can get to work on time and have good rapport with your job, of course. Then you create your I statement. Now express it to your child with a neutral tone. Often kids are more receptive to more of a neutral tone rather than showing them the frustration at first. It can simply just be like, I'm feeling frustrated because we aren't able to get into the car on time so that you're able to go to work and see your friends or something like that. Um, when doing these I statements, it's important to know that the anger and frustration that you experience is separate from the bond you have with your child. I think sometimes it's easy to pair the two, that you're feeling so frustrated that it's worrisome that you're always feeling frustrated with your kid and that's always how they see you, but that's not always true. Your anger and frustration is coming from the care that you have for your child. It's just a matter of reframing it. Handling anger and frustration is an ongoing process. So there's 4 steps in such a quick moment, but it's important to know that this takes practice. It's not going to happen the first time. It's just a matter of being able to reflect on your feelings and what's going on in the moment. And lastly, it's helpful to model regulation outside of interactions with your child. So model how this looks with family, with friends, and even interacting with their teachers, and being able to talk about your emotions openly and accept what they are and not getting frustrated for what they are in the moment.
Okay, so our final point we're going to go over is deep breathing. So deep breathing is a really common and very grounding mindfulness-based practice. They found in the Nathanson et al. Study that mindfulness-based practices, including deep breathing, can really produce meaningful and significant reductions in parent stress. If parents are emotionally regulated, we can see that children might be negatively affected by that. So it's really important to try to regulate yourself as much as you can, and deep breathing is a really great strategy for that. Mindfulness, including deep breathing, once again, can really help increase your awareness of the present moment to help you kind of connect with your body and have a clear headspace to be able to handle conflict and disruption and all of the things. So here are some deep breathing techniques. So deep breathing kind of just is this idea of contracting your diaphragm by slowly inhaling and slowly exhaling. So there's a few different techniques here. The first one at the top is called box breathing. So where you breathe in for 4 seconds, hold that breath for 4 seconds, breathe out for 4 seconds, and then wait for 4 seconds. So just kind of repeating that cycle until you feel that you're kind of calmed down. There's also the 4-7-8 technique. So that's breathing in for 4 seconds, holding your breath for 7 seconds, and breathing out for 8 seconds. So you can see that there's long periods of inhale and even longer periods of exhales to really put an emphasis on that contraction of the diaphragm and to really get you back into your body. And then there's also this idea of figure 8 breathing. So you can draw a figure 8 somewhere or use a graphic like this and kind of use your finger to trace the shape of the infinity loop or the figure 8 and inhale as you're tracing the one side of the loop and exhale as you're tracing the other side of the loop in a like rhythmic pattern as best as you can. So all these techniques can be really helpful at just helping you ground yourself in the present moment in the face of difficulty or arguments or any kind of tension. This can really help you show up as the best version of yourself and allows you to just kind of ground yourself in your body and come to a place where you might be able to respond a bit better. So yeah, this is just our final reflection on the topics of the 3 things that we discussed. So try to find a support group locally or online. As Quinn discussed before, it can be really helpful to have that peer connection. And then identify a deep breathing technique that feels really good for you. So any of those deep breathing techniques that were offered, or you can even look up more online. There's so many different ways to kind of emphasize that slow inhale and slow exhale, or just kind of do it the way that you feel works best in your body and that naturally comes up for you. And then also building your communication through I statements. So I feel blank can really help you communicate what you want to say to your child without necessarily with just conveying your own feelings and being able to be really open and honest, which can decrease your stress and decrease the family stress overall. These are our references. Thank you guys so much.
Thank you.
Thank you.
I think that pauses screen sharing, but if you, oh yeah, there.